I want to welcome Mr. Bernard Wheatley as the new Chief Executive Officer of Schneider Regional Medical Center. Also, Mr. Wheatley, I want to offer welcome on behalf of Governor John Leon. Wish you the best in your new role, and he's very impressed with your credentials and your vast experience, and is looking forward to you working with his administration on a number of healthcare initiatives. So I express welcome and thanks and best wishes from the Governor of the Virgin Islands. It is, if you have read Mr. Wheatley's bio, and if you know, even just a little bit about him, I think you know that he is a native of the Virgin Islands, a native of St. Thomas in particular, right? So I think this is also a welcome home for Mr. Wheatley. But more importantly, though, he comes to us with a wealth of experience in healthcare administration and healthcare management. And that is precisely the reason why he's sitting here with us today and being introduced as the new CEO of Schneider Regional Medical Center. When I first met Mr. Wheatley, one of the things that I picked up very, very quickly was his, the type of emphasis, a lot of emphasis, and a general commitment that he placed on his own professional development. And that is very evident, not just from his bio, but in any conversation that you have with him. He started out as gaining a certificate in radiology as a radiology technologist. And his progression from there was quite remarkable from an educational standpoint. He has a Bachelor of Science in Health Administration from St. Joseph College in Brooklyn, New York, a Master's in Business Administration from New York Institute of Technology, and a Doctor of Business Administration with a concentration in Healthcare Administration from North Central University in Arizona. So he definitely has a thirst for knowledge, but I think what's also noteworthy about Mr. Wheatley is that he's very much interested in imparting his knowledge, what he has learned through experience and education, to others. And he has done this quite a bit as well. He has served as an adjunct lecturer in the Department of Radiological Technology at the New York City College of Technology. He is also a regular invited lecturer at the University of Georgia in the areas of public health and healthcare management. I think it will be difficult for him to maintain that being here in St. Thomas, but maybe we could introduce him to the folks at the University of the Virgin Islands. Of course, he brings a wealth of experience in hospital management to his new role. He has held jobs including Assistant Vice President of Radiology and Ancillary Services, Vice President of Operations, and Senior Vice President and COO at hospitals in the New York and New Jersey area. Previous to joining SRMC, he was Vice President of Athens General in Athens, Georgia, a job he held for 17 years. So a lot of stability as well. Without further ado, I introduce to you Mr. Bernard Wheatley.
Sometimes I didn't say what happened to me. I said, well, I got lost for 40 years. And now I just came back to where I was born and went to school right here in the U.S. Virgin Islands and left in the late 60s. I just want you ask me for questions, or you basically I could just talk a little bit about. When I interviewed, there was obviously some clear objectives that was presented to me by the board in terms of Schneider Regional and taking this organization or transforming it to a different level. And I feel that I bring the leadership skills over 30 years in healthcare abroad, along with the educational background to do so. I enjoy a challenge. This is a challenge, and I look forward to taking this organization into what we call a journey to excellence. To have a journey to excellence, you need to have a passion for excellence. And so the members of the Schneider family, I like to call it, because we are a family, medical staff and so on, we'll be working together to make some changes in the organization for the better. Let me regress just a little bit, and I'll tell you, my first day was Saturday, and in the cleanup, spring cleaning, and I'm absolutely amazed at the medical staff that was here, and the members of the community, by the way, and high school and so on. Quite a few doctors are here that I saw over the weekend, and I was amazed at that kind of an effort to really spring clean the organization. Tells me a lot about the commitment for cleanliness. And why that's important to me is because you know, first impressions are lasting impressions. In this business, patients come into an organization and it doesn't present very well. Many times they don't come back. And so we have to make it presentable, not only from our own personalities and how we portray this organization, but how it presents both externally and internally. And that's not easy to do sometimes, but it's what makes the healthcare system works for us. While it is a business, and we can't say it's not a business, it's about caring and compassion for our patients. The patients, you know, we as administrators cannot admit a patient, physician can't. So we have to really work very good with our physicians and with the board to take this organization to a different level. As much as we enjoy working, at the end of the day, the patients is who makes this organization, because without the patients and without us taking care of those patients, we wouldn't have an organization. So it's a little model that we use sometimes. It's the right patient at the right time, the right place, and the right care. And that's very important to me. And like I say, the presentation of the organization to me makes a lot of sense, and the way the staff treats the patients, especially while they're here doing our state, because that's all we have. As a matter of fact, I like the model that's being done by Dr. Feinberg out at UCLA and around Regan Hospital, where the administrators and the directors are actually spending more time with the patients. It's more of a compassionate care. Yes, it's a business. We need to look at revenues and so on and operational efficiencies, but at the end of the day, it's the patients who actually really get us to a certain level. Again, I mentioned that the physicians is very important because there has to be an alignment with our strategies and the way we move the organization forward. If we need the equipment for the doctors, if we need to have the technology, we need to be able to also affect the patients. We need to be able to work together as a team. This is a big family. From the standpoint of our overall perspective, this is a very early stage for me, so I have to basically look at the lay of the land and assess a number of things, including the executive team, and certainly figure out our strategies as to which way we need to move. There's a few things. There's the pillars of excellence, and this organization does use pillars of excellence. They're out of Harvard, Dr. David Norton and Dr. Kaplan, called the Balanced Scorecard. And those metrics are very straightforward. It deals with people. And I'd like to go back to Jim Collins out of Stanford, who talks in his book, Good to Great, Why Some Companies Go From Good to Great. Another book he wrote was Built to Last. We model that into healthcare, because if you take an organization to a different level, he uses a point of the gear wheel and the big flywheel that's constantly turning and moving in the direction for positive impact. It's like the analysis of the duck in the water. All you see is the head. Below the water, there's a lot of pattern going on that no one sees, because that's how we move the ocean forward. He also said that people are not your greatest assets. Best people are. So it takes time to assess the staff and obviously to see how things are running, because people can be your assets, but sometimes maybe not in the right positions, or maybe not on the right ship, so to speak. Talks about financial viability. Well, we've got challenges. Everybody knows what's going on across the country, why the finance of this healthcare system has been so prolific in terms of discussions on the federal level and the state level. When you are 18% of the GDP, and when you're spending $792 billion a year in healthcare, and the outcomes for American lives are no better than they are in Germany, France, Europe, and so on for outcomes, you have to look into this whole process. And that's where the ACA come in, the Affordable Care Act of March 2010, which was ultimately supported by the Supreme Court decision. Because in that particular bill or law, it deals with a lot of quality issues and driving efficiencies and so on, and medical outcomes. And now they're going into a whole phase of pay for performance, and the doctors and the hospitals are catching a lot of heat over this process, because that's where, fair or unfair, that's where they're heading with the way this whole thing is going. Like I say, when you are $793 billion of operation, in terms of, if you look at the pie for the federal expenditure, in terms of the Social Security, Defense, and CMS, the Central Medical Services, healthcare is the highest piece of the pie. Is it fair what they're doing? I'm not exactly sure, but we really have to tighten our belts here, and that's why the challenge for all CEOs and all executives across this country is to operate more efficiently, and to reduce the costs, remove the waste out of the organization, and then maximize your revenue potential, which really impacts us and the medical staff. And so that'll be one of my challenges. Talks about growth. You have to grow the organization. If you're not growing, then you're stagnated, and something is wrong with that picture. We talk about community needs. And you do it here. We do community assessments. Are we in the right niche markets for the people in this community? We have the right services being offered. There's sometimes there's a study from out of Dartmouth, which they actually look at different zones and areas of the country and can tell exactly what type of disease is going to be very prolific in those areas. For example, in the South, there's a lot of kidney problems because people drink a lot of iced tea, and there's sediments from iced tea, and they can predict. So are we doing the right things here, and so on? We have to look at our services. Are we offering the right services for this community? And the other piece of it is strategic planning. My CEOs always say, if we don't have a plan, where it end up doesn't really matter. So we don't really want to end up where it doesn't really matter. We need to end up with a plan and continue to focus on our strategic plan, and focus it based on the target areas that we see and the growing of the organization into a better facility. If we are going to indeed be the premier healthcare center in the Caribbean, in the U.S. Virgin Islands, as well as the Caribbean, we have the propensity here to do that. I don't see our physicians being advertised very much at all. We need to advertise our physicians. They are well trained, they're U.S. trained, they're certified. People need to know that we can perform certain services here, and rather than people leaving off island constantly to go abroad for care that's sometimes not as good at all, and come back with some different stories. So it's kind of an overview of where I think things are going, will be going.